here today with Adolfo, and we are going to be treating you for that neck. Explain to me what's going on with that neck. You feel tightness, and what happens when it tightens up?
It stays tight. It just affects my fingers.
And what does it do when it affects your fingers?
It cramps it.
So, and whenever it cramps up like that, what happens if you have something in your hand?
I can't hold whatever.
So you're losing your grip strength and everything with that. So if you're holding a hammer, it will just drop it.
It will drop, or I
Okay.
have to set it down. I can.
All right. So what would you say your discomfort level is with that neck, 0 to 10?
I would say about 5.
Okay. Up as high as you can go. Can you go up over your head?
No.
That's as high as you're going to go?
That's it. I can.
Okay. How far can you reach up your back? Okay. Now with your other hand, how far can you reach behind your back? Wow, you are really tight.
Feel secure that you can do this. You're just hanging. You're not doing a pull-up.
I used to do chin-ups like I'm crazy.
So feel your grips, okay?
Yes.
All I want you to do is take some of your body weight and come down. Okay? Now I want to work this out here like that. Alright. Any pain yet?
No.
Okay.
Right here.
Okay.
Yeah, before what he did, right now, before what he did, this wouldn't go up. This would, right here would be killing me by the time I got here.
All right, we're back with Adolfo. Is the pain a little bit less when you're doing it that way?
Probably less, but it still hurts.
Okay. One arm behind your back, how high can you go? You noticed any changes?
Can't really tell the difference, but I think a little. But then I don't know, because of what we just did. It's making my.
Your muscles are probably fatigued and tired.
Yeah.
So we haven't even done therapies yet. So we're going to do some therapies, and then we're going to redo this after you do some therapies, okay?